Now we proceed to our second presenter, Dr. ADNAN KISA from KRISTIANA University College, Norway. ADNAN KISA is a professor of health policy and economics at Health Science and has extensive global health policy research experience with a focus on health and economic development, use of health services, comparative health system, cost of illness, cost effectiveness of intervention in the healthcare system, and research on health outcome. Dr. KISA has more than 100 peer-reviewed published articles, books, book chapter, research report in health policy and economics, and he is a member of many international health institutions, scientific boards, and editorial boards. Dr. KISA was the principal investigator for the Turkish National Burden of Disease Cost Effectiveness Project financed by the World Bank. And he is a curator of the Institute of the Health Metrics and Evaluation of UW Seattle, USA, the WHO Innovative Care for Chronic Condition Project, WHO Adherent to Long-Term Therapies Project, WHO Health Survey and Value for Vaccination Research Network at the Harvard University. Dr. KISA has received many awards and recognition related to teaching, research, and service throughout his career. Dr. KISA also holds adjunct professorship at Tulane University and University of South Carolina. Presenting paper on digital health economics, Norway path to viability. Please welcome Dr. KISA, Dr. ADNAN KISA.
Oh, thank you very much for this nice introduction. Good afternoon to all participants. Before I start my presentation, I'd like to thank you. I want to thank all of organizers of this wonderful activity, and also Dr. Roy. He was the leading person, and thank you very much for kind invitation. We have 6 hours time difference between two countries, but this is almost 9:30 around here, so not very early. This is the good part. I woke up, and today I will share Norway's experience regarding digital health economics. So I can use the screen, I think, or we can continue like that. No problem for me. Okay. Norway is located a little bit out of the European continent. You can easily see we have really large. The country is located on a large area. The population is almost 5.5 million people, and 18% of the population live in rural area. So which means still, even though 82% of the people live in urban areas, but the distance between the cities are very far. So the importance of using digital health platforms we can see in here. The per capita income is very high, so it is among the top 10 wealthy countries, I can say. Next slide, please. Very quick introduction to the Norwegian healthcare system. It is completely tax-funded healthcare system, and the decentralized public governance structure we can see. The government owns almost the majority of the health system, especially the system is very strong in terms of primary care delivery. So by using primary care services, people can easily access to general practitioners, and general practitioners are the gatekeeper of the system. Next slide, please. If you look at the map in here, you can see that the majority of the people are located in big cities like Oslo, like Agder, Bergen, and also in Trondheim. So even though the country is 5.5 million population, the majority of the population are located in the bigger cities. Next, please. You can see a comparative table in here regarding the socioeconomic and health characteristics of the countries. This is based on 2019 data. There is not big difference. But when you compare with the other Nordic countries versus US, it's a completely different system. life expectancy of Norway is very high. And when you look at the child mortality and also under 1 and under 5 mortality rates, the Nordic countries are performing very well compared to US, for example, in here. But the health expenditures is around $8,500, and it will be by 2050, it will be more than $10,000, which means the health expenditures are going up. Yeah, next please. Of course, health inputs are very important, especially we are talking about health literacy, we are talking about digital health. So when we look at the physicians per 1,000, nurses and midwives per 1,000 population, and hospital beds per 1,000 population, Norway is not having enough number of physicians in terms of per 1,000 people compared to other neighboring countries, Nordic countries. And the number of nurses and midwives are so far looks okay, but we need more nurses. And hospital beds per 1,000 population are around 5 per 1,000 population, which means still we need more hospital beds. But of course, running a hospital is a costly intervention. So the government is controlling the hospital system in Norway. This table is very interesting because it is showing the top 10 causes of death in Norway and also other surrounding countries. I also compare with US and Canada to give you some kind of information. What we see in here, we see the majority of the leading causes of death in Norway are the chronic diseases, mostly ischemic heart diseases, stroke, Alzheimer, lung cancers, and all type of other cancers like colorectal cancer, prostate cancer, and pancreatic cancer are the leading cause of death in here. And these major chronic diseases are forcing the health system to find cost-effective interventions to reduce this burden. But if you compare with the other surrounding countries, the US and Canada, there is not much difference. So the majority of the diseases we can also see among the top 10 over there. So ischemic heart diseases and cancers are the leading cause of death in all countries. Please, next, please. I don't want to go and talk too much about the Norwegian healthcare system, but in here it is important to note that under the roof of Ministry of Health and Care Services, we have a Directorate of e-health, specifically focusing on digital health and e-health related activities in here. And it was established in 2016, and it implements the national policy on health and also sets up some kind of national standards and also try to adopt internationally developed standards for the national use. And also the Directorate administers the use of e-health methodology nationwide. So there is a governing body and who is responsible running the e-health related activities in this country. Of course, not only acting alone, this directorate is also collaborating with the other ministries in Norway. Next, please. The Department of Health, again, they coordinate the healthcare digitalization in this country, manage the health data and digital security, because digital security is very important. Therefore, for example, they need to collaborate with the Ministry of IT in this country, because the digital security is one of the major issues that we need to discuss, especially when we talk about digital health in here. They also develop national framework conditions for the digital solutions. When we look at their focus areas, they focus on digital healthcare interaction, digital services for citizens and healthcare providers. Health data management is also another focus area. Digital security and privacy, ICT infrastructure, and international e-health cooperation are the responsibilities of the Department of e-health. Next, please. When we look at the notable services of this directorate and also impact, of course, impact is very big. There's a really good digital health platform called Helse Norge, which means health Health Norway. And this platform is very useful platform. I will give you more information about this. And these notable services are also digital communication between citizens and healthcare providers. E-prescription is very important because without going and seeing your GP, you can renew your medicine. And they also participate to European health data space. When we look at the impact of these e-health services under the leadership of this directorate, we can see that improved healthcare efficiency, enhanced data security and privacy. We see that more empowered patients through digital access, streamlined medication management, and also facilitation of international health collaborations we can see as an impact. Next, please. I also, for the purpose of this meeting, I also checked the national e-health strategy of Norway, and it is for the years of 2020 and 2030. Between these three main goals, they like to achieve quality and coherence in the services, sustainable health and care sector, and innovation strength in here. And they have 5 detailed strategic objectives to achieve those overall goals. One of them is active participation in own and close one's health, easier working day, health data for renewal and improvement, available information and strength collaboration, and also cooperation and instruments that strengthen implementation. Yeah, at the end of my presentation, I also provided the detailed links for those reports. If you'd like to see more detail about the Norway's experience, you can go and look at this national e-health strategy in English. Next, please. So when I look at the all e-health strategy and look at how they are aligned with the Sustainable Development Goals, Sustainable Development Goal 3, 10, 12, 13, and 17 are directly and indirectly related to those overall goals of this national e-health strategy in Norway. Next, please. Of course, when we talk about the economic side of digital health and digital health literacy, we know that if we use a good e-health infrastructure in a country, we can have cost reductions at all categories. One of them is travel cost reduction. So less frequent time to travel from healthcare facilities to homes. If, for example, if you are living in a rural area, of course, remote monitoring tools, mobile health applications, and telemedicine are wonderful e-health interventions that we can wisely use. The other one is infrastructure optimization, which means e-health reduces the need for expensive physical health infrastructures by digitalizing services, so you don't need to invest more for the physical infrastructure more. And there are also cost-effective resource distributions and overcoming geographical barriers in rural areas that we can see under the category of infrastructure optimization. And using more the e-health initiatives also lower the hospital admissions, and also which means you save money to improve the health of the population in all countries. For example, it is saved amount because unnecessary hospital admissions, and also savings because unnecessary hospital admissions and visits will create you more opportunity to invest in other parts of the health system. Next, please. When we look at the indirect economic advantages of e-health, we have decreased work absenteeism because fewer absences due to in-person health appointments or prolonged hospital stays we can see, and enhanced productivity we can see. For example, e-health accessibility saves time, promote work-life balance, and especially for the working class in secluded regions. And it can also increase the quality of the life. So improved health management via wearable tech, health applications, and online resources can help us to increase the quality of life because we are getting different health intervention. to see the benefits, which means we can also reduce the stress due to easier access to healthcare and health information. So these are the indirect economic advantages of e-health. Please, next, please. Okay, this is one of the health platforms that we use in here. One of them is DIPS, electronic patient profile. It is used by the 80% of the Norwegian hospitals in here, and more than 100,000 health professionals uses this in Norway, and 4.3 million patients have access to these journals, so their journals. And if you look at the efficiency increase, overall operational efficiency by 30%, and they have annual saving of more than 20 million kroner we have by using these electronic patients. The objective of this system is to provide a unified digital health record system for efficient patient care. It is directly associated with the Sustainable Development 3, good health and well-being. When we look at how the system, this platform, have impact on the vulnerable population, it ensures that consistent and error-free health record access is provided because of this electronic patient journal. Please continue for next slide. The other one is Helse Norge, the national health portal. This is used by almost all people. So you can easily access your health information, renew your prescriptions, and communicate with the healthcare services. There are also some live chat boxes over there. And also, if you need more information, you can find guidance from the system. More than 2 million Norwegians actively use that system. If you look at the economic impact, reduced administrative overheads by streamlining the patient-hospital interactions, we can see in here. And it centralizes health services, information, and patient communication on a single platform. It is directly linked to good health and well-being, number 3 of Sustainable Development Goals, and number 9, industry, innovation, and infrastructure. When we look at the benefits to vulnerable population, the system offers a centralized platform for those in remote areas. Next, please. Another one is Hjerne Journal. It's called Shared Health Record. It's a digital platform, national health system that shares health data across the health services. It provides healthcare professionals with fast access to key health information, especially in acute situations. It has medical conditions, vaccinations, donor card, medicines, test results, documents, and appointment history. And it is available to hospitals, general practitioners, out-of-hours medical services, and also municipal nursing care services. And patients can limit their access if they want and block certain professionals or receive notifications on data access. So they have a control over this shared health record. Next, please. And if we look at the results, many medical record errors are reduced. There is an enhanced data accessibility for healthcare professionals. So when we look at the major economic impact, the system is reducing repeat tests in here. Minimum 10 million kroner annually we save by using this system. It is directly associated with the Sustainable Development Goal. When we look at the benefit to vulnerable population, the system is prevention of medical errors for patients with multiple conditions. So it's a good running system that I can say. Next, please. Of course, telemedicine is one of the best intervention that many countries use. Turkey, telemedicine is widely used in Norway. Norway is one of the first countries implemented telemedicine related intervention. They started to implement the Norwegian government has started to implement the telemedicine initiatives in 1990. And we have 4 regions, and these regional authorities operate multiple hospitals aiming to provide equitable healthcare access in here. So telemedicine is widely used by these regional authorities also. When we look at the geographical distribution of the people, and the country is very big, so we have really big, most sparsely populated population in here. So mainly residents in remote areas with limited access to traditional medical services use telemedicine in Norway. Next, please. There's an initiative called Norwegian Telemedicine Initiative. Rural areas of Norway, especially in the north, it is widely, they have different interventions. They reduce need for patient transportation, timely medical consultation. When we look at the economic impact rate, they have reduced, the system has reduced travel-associated costs for patients and healthcare providers. And when we look at the sustainable development goals, it is directly related to the sustainable development number 3 and 10. And when we look at the benefit to vulnerable populations, the system enables both in rural and underserved areas to receive timely consultations. Next, please. If you look at the adoption rate, 100% at the regional level, 75% at the hospital level, and 21 out of 28 hospitals actively use telemedicine, and the usage has increased, especially neurosurgery rehabilitation care are widely used, but we can see that the telemedicine is also used for cardiovascular diseases and also diabetes treatment. And also you can also have the digital dialogue with your general practitioner by using this system. Next, please. There is a really good running prescription system. So it's a nationwide, and 90% of all prescriptions in Norway are now electronic. And it reduces paperwork, fever medication errors, and an estimated annual saving of more than 15 million Norwegian kroner. And it is directly associated with the Sustainable Development Goal and streamlines medication management for elderly patients in remote areas. So this is a wonderful system. So these elderly people and vulnerable population don't need to move physically to get their prescription. So when we talk about the direct economic impact, indirect economic impact, and societal impact, I studied those impacts under the categories of these digital health platforms. Of course, many of them are related to reducing duplications of medical tests, reducing administrative costs, less paperwork, elimination of the costs associated with the paper-based prescription system. Those are the direct economic impact. Of course, enhanced coordination among care workers, increased health literacy, and more trained health manpower are the indirect economic impact in here. But overall, when we look at the societal impact of those digital health platforms, what we see that a good monitoring system is it is working very well, and also people can easily share data. Of course, these people are health professionals, and sharing data, getting better information about the patients and the people can lead to better population health management in Norway. Next, please. In terms of health literacy and sustainable development goals, the system recognizes the unique needs of vulnerable population in relation to digital health literacy and explores strategies for promoting digital health literacy among underserved communities and assess the potential impact of inclusive digital health literacy initiatives on sustainable development goals. So these are the three main things that I can talk about, these 5 e-health or digital health platforms. So these are the more centralized platforms for health information for the patients, eliminate the geographical barriers for the people, and also a good prescription system also help them to use efficient use of medicines, and also patient-related health information are widely shared among the health professionals from primary care level to up to tertiary care level. So all of them are having direct impact on improving the health literacy level of the people in Norway. Next, please. By 2025, Norway aims to have 95% of its elderly population to use digital tools for health. A lot of direct cost savings from reduced hospitals visits. We can see 25% of reduction in costs associated with the patient, for example, living in one of the less populated area in Finnmark, for example. 94% of all prescriptions are e-prescriptions. 96% of the municipalities send electronic referrals to hospitals. Telemedicine is widely used to improve access to care and provide continuous education. And also, in very sparsely populated areas, peri-hospital emergency services are provided within the municipal home nursing facilities with the support of telemedicine. These are the some facts that I highlighted for the participants of the conference today. Next, please. Some examples, these are the final slides. For example, chronic disease management, we have digital platforms like My Health platform. It reduces 20% of the reduction in hospital admissions for chronic disease patients. For the mental health related service, there is an example platform called Health Talks. It reduces 15% of more patients treated with the same resources and saves a lot of amounts of money annually when we run these digital platforms. So people feel more convenient to reach out and also use these sample services in here. Next, please. In conclusion, when we look at the Norway's pioneering approach, digital health initiatives as a kind of benchmark of cost effectiveness. When we talk about the universal accessibility, technology is a key. When we talk about the efficient health outcomes, of course, technology improves the health results of the population and has a great impact on mortality and morbidity and life expectancy and life quality of the people. It's a sustainable model. It's an innovative model. So we live in a Scandinavian area and Nordic area. So the countries are also sharing their experience to each other. It's a kind of good innovation to share and learn from other countries. And it's a kind of the standards that we have in this country regarding digital health follows the international suggestions. And the final and important part is empowering vulnerable population, because when we prioritize the digital health to bridge the healthcare gap for rural and vulnerable population, it is really a good tool and cost-effective tool to reach those people living in rural areas and those people don't have enough time or work time or opportunity to reach their healthcare provider. It's a good option and it's a cost-effective intervention, I can say. Next, please. Next, please. Thank you very much for this wonderful opportunity. I share some Norwegian experience, so very practical applications I share. You can see some views from Norway in here. At the end of this session, I know that there will be some questions from the audience. So thank you again for listening.